Humans are the only reservoir of Salmonella typhi infection, as well as the only natural host. So, in other words, humans are the only causative agent of the disease and act as its source of further infection. Among humans, there are several types of carriers. Um, Salmonella typhi is known to mainly colonize the gallbladder, and it remains there long after symptoms subside. The most common sites of infection are the ileum, the liver, the spleen, bone marrow, and the gallbladder. There's also a strong correlation between the chronic carrier state and the presence of gallstones. The carrier itself may be temporary, incubatory, chronic, or convalescent. Convalescent carriers shed typhoid bacilli for more than 3 months after the obtaining acute sickness. However, relapses may occur. As far as chronic carriers go, about 2 to 5% of those that have contracted typhoid fever will be chronic carriers. A chronic carrier is one who sheds typhoid bacilli for more than 12 months after the obtaining of the acute sickness and has no history of typhoid or had the disease over 1 year previously, yet has 2 feces or urine culture samples positive for Salmonella typhi separated by 48 hours. Other carriers can be known to have typhoid bacilli isolated from tissues or organs via surgery or from draining lesions. And the signs and symptoms during the first week of typhoid fever is a sustained and systemic fever. It starts slow and increases daily. So this means that in the beginning of the day, one might have a very mild fever, and throughout the day it increases to get more intense. And this happens day after day, often as high as 103 or 104 degrees Fahrenheit. Also coupled with this can be severe headaches, weakness and fatigue, dry cough, loss of appetite, abdominal pain, diarrhea or constipation, or rash. The signs and symptoms during second week include, but aren't limited to, continuing high fever, severe constipation or diarrhea, considerable weight loss, and an extremely extended abdomen. During the third week of typhoid fever, one might see themselves becoming delirious, lying motionless and exhausted with eyes half closed. This motionless and exhausted state is known as a typhoid state. During the fourth week of typhoid, improvement may come slowly. At this point, if one has survived, they will be continuing to get better. Fever will likely decrease over the course of 1 to 2 weeks, and signs and symptoms could return up to 2 weeks after. Other symptoms include hepatosplenomegaly. Now this is the simultaneous enlargement of both the spleen and the liver. Also, other symptoms may include a transient macular rash of rose-colored spots. This is usually found on the trunk. And after 2 to 3 weeks of illness, one may notice intestinal hemorrhages or perforation, both of which can be life-threatening. Now, typhoid fever among children, their signs and symptoms tend to be pretty similar. Sometimes they become sick, and yet signs and symptoms take 1 to 3 weeks to appear after exposure. So when should one see a doctor? Immediately. I mean, if you have typhoid, go immediately. Come on, look at that guy. Yeah, he seems pretty nice. Why wait? What do you got? What other pressing matters do you have? Just do it. But, if you are traveling and you don't have a doctor, one will be provided for you. I'm sure the place that you're visiting doesn't want typhoid to spread rampant. You have the right to remain healthy. If you don't remain healthy, then you will be sent to be quarantined like Typhoid Mary. Okay, probably not, but look how angry she is. Treatment. Initially assessed by blood culture or bone marrow culture, as well as sensitivities to antibiotics. So we have antimicrobial therapy, which shortens the clinical course of typhoid fever, good thing, and reduces the risk of death, also good. There's empirical treatment. The empirical treatment mostly is used fluoroquinolones. However, cephalosporins are used when fluoroquinolones non-susceptibility is high. This is present in Asia and India. Azithromycin is increasingly being used due to the emergence of multi-drug resistant strains. Management. Patients treated with an antibiotic might still require 3 to 5 days for the fever to subside completely. However, if the fever fails to subside, alternative antimicrobial agents should be considered. Unstable patients should be hospitalized and given IV treatment. And those that are caring for the patient that is hospitalized should also be meticulous about hand washing and of the disposing of the urine and feces of the patient, so as to not contract typhoid fever as well. Prevention. The most important type of treatment is prevention. The most important protocol to prevent typhoid is to follow recommended food and water protocol. If in a location where typhoid is a danger, one should eat cooked food and bottled water only. One should avoid salads, uncooked vegetables, as well as unpasteurized dairy products. See, look how, see, he doesn't want to eat that. It's uncooked vegetable. One should also wash hands frequently. One should be aware of the diseases that are prominent in the areas that they travel. Typhoid vaccine is recommended by the CDC for travelers where there is an increased risk exposure to Salmonella typhi. Vaccines available in the U.S. include 1. Oral live attenuated vaccine, Vivotif, or bicapsular polysaccharide vaccine. However, the vaccines protect only about 50 to 80% of recipients. So, if one gets a vaccine, they should still follow safe food and water procedures when in areas that may have typhoid fever. And that is our resources.